things off here.
Okay. All right. That sounds great. All right, everybody. Well, officially, thank you so much for joining this evening, and Happy New Year. And I hope, especially given all the challenges that we had,
Sorry, Al.
My
is
original thought on this was
that this has been
that
a
my team doesn't
as good a
hold the
possible
licenses.
holiday season where you got to have some joy and fun alongside of everything else. I was just going to remind everybody from an administrative perspective that if you can put yourselves on mute, and if not, Alex and Kelly might anyway. And as per usual, we're also recording this session. I want to say that that means you shouldn't say anything that you wouldn't say in front of your mother. And given that my mother is on the call, that's especially true for me. But we just use those recordings for friends and family of the hospital. And as we usually do with the format here is I'll introduce the president of the hospital, and he'll give a COVID update and a general hospital update briefly. And then I will introduce our speaker, about 30 minutes of a presentation. And I believe that Dr. Manning this evening will ask us all to share in the chat any health goals that we have for the year. And if you go down to the bottom of your screen on Zoom, I'm sure everybody's an expert by now, but there is a chat feature where you can enter your comments there. And also if any questions come up along the way for either John or for Dr. Manning, we'll probably cover those at the end, but that's also a good way that you can get those to go forward. So I'll first introduce John Fogerty, our president of BID Needham.
Good afternoon, everybody. Thanks, Sam, and thanks, Beth, for being willing to speak this evening. Obviously, it's a popular topic, and you're a popular physician. I think half of these people are just trying to get into your practice if they're not in it already. That's why they signed on. But welcome, everybody. I will only stay in Beth's spotlight for a couple of minutes here and give you a quick update on what is going on at the hospital. And I think it suffices to say there's a tremendous amount going on at BI Needham right now. First off, just one really positive note, we ended the calendar year of 2020, I think on a plus. We finished our Joint Commission survey, which is a 3-year accreditation survey. The survey actually occurred in the summer, but it takes a while for the commission to render a final accreditation decision with these surveys. And we're happy to receive a full 3-year accreditation from the Joint Commission. That's a big relief for any hospital because they only come around once every 3 years. And if you're not familiar with it, it's really kind of a soup to nuts survey of everything we do, from nursing to engineering to medical care to housekeeping, everything. So really, really good report on that. Secondly, we did very well in our Leapfrog survey in the second half of 2020. Leapfrog, if you're not familiar with it, is sort of a healthcare watchdog group that is a kind of a business quality safety group that was put together several years ago that actually grades hospitals on their safety and quality performance, much like you would have had in school, A, B, C, D, F. We were really happy to report that in our review for the second half of 2020, we had the highest raw score in the BILH system and are a hospital. Now those accreditations those scores only are good for 6 months, so we don't spike the ball in the end zone too much, but it was a really nice way to end the year. As you can imagine, most of what has been consuming us for the last month or so has been the COVID resurgence. And I think everything you're reading in the paper is going on at BID Needham. We went through the surge in the spring. It changed the hospital. I think it changed the state. And we're going through that all over again. So there are differences this time around with this surge. Frankly, most of them more difficult in a lot of respects than in the spring. We have as many COVID patients now, inpatients, as we did last time around. So as of today, between patients that are confirmed COVID positive or are COVID suspect, basically 50% of our inpatients today we're treating as COVID patients. So if you're a nurse, it doesn't, as a matter of practice, really matter in some respects whether the patient is COVID positive or COVID suspect. You still have to don all the PPE and treat the patient as though they could be infected. What is different this time around is that the state has not shut down. So in the peak of the pandemic in the springtime, society was shut down. People were terrified to go to the hospital. And while we were busy with COVID inpatients, no one was coming to the emergency room. No one was, we had completely stopped all elective surgery and outpatient visits. This time around, a lot of those services remain quite busy, and we are still very, very busy with the COVID inpatients. So it's a busy and I will say very tough time for our nurses and physicians. High stress and just a lot of work. The other thing that has been a challenge is that with the surge that has occurred throughout the country, many nurses that we would have relied on, temporary nurses, traveling nurses, have been pulled out of the market and gone to other parts of the country where the surge has hit, frankly, due to more lax masking practices than you see in New England. So Needham and every hospital in the state is really struggling to staff those beds. So it's a busy, busy time. Our ICU at the hospital is full with COVID patients, sick patients, about half of them vented on ventilators. We opened a couple of overflow beds in our PACU, our recovery room, a few days ago. So we have significantly dialed back on elective procedures, but we are still doing some elective procedures at the moment. So it's a week by week, day by day thing for all of us. So in spite of that, I'm still pretty inspired by the backbone of our nurses and our doctors who continue to come in every day. I honestly, some days don't know how they do it. I equate it sometimes to a soldier getting redeployed to the Middle East 4, 5, 6 times. That's really how difficult of challenge some of these folks are facing. So, but some rays of light in it all. We are, in spite of the statewide surge, as of a couple of days ago, starting to see some indications that the crest is starting to come down. So again, that could change in a day or in hours, but as of Friday, the state's COVID hospitalizations started to tick down about 3, 4, 5%. Some of the hospitals in the BILH system, not Needham yet, but some of the hospitals in the West and the Leahy side of the family are saying, you know, we are really starting to see it loosen up. So fingers crossed that is a trend that will continue. We started vaccinating our employees in the middle of December. Very excited about that. We at Needham have vaccinated about just shy of 500 of our staff with the Pfizer vaccine. We're starting the Moderna vaccine this week. It will take us a while to get through. I would say overall, we've probably vaccinated about 60% of our eligible employees, and we are also vaccinating other members of the BILH workforce who may live in the area. So it's inspiring to see people lining up for those vaccines and a lot of employee interest. So that's really going very, very well. We are grappling on top of COVID with a very big surge in volume from Norwood Hospital. For those of you who didn't catch that news story, the Norwood Hospital experienced a flash flood at the end of June that completely disabled the hospital. The hospital is closed and has been closed since that time. We have no idea when they're going to reopen. So that overnight, our staff never got a COVID reprieve because as the pandemic came down, Norwood closed, we saw a 30% volume increase overnight. So the staff has really stepped up, but we're finding that we're managing those patients. Two things that have really helped us in that regard. We implemented a 10-hour-a-day intensivist program in our ICU, where specially trained intensive care medicine doctors are now on board from the Beth Israel Deaconess Medical Center. We implemented that in early November, just prior to the second wave of the pandemic hitting. So that has been fantastic. We have also had some real success in bolstering our behavioral health program with a behavioral health navigator that we have started to recruit, and we're working very closely with the folks at Riverside Mental Health. With the Norwood closure, we almost quintupled our behavioral health psychiatric volume in the emergency room overnight. So lots and lots of changes. I'm pretty confident that, we are at the peak of the mountain and starting to look down the other side. But lots of work to do, and I can't brag enough about our nurses and physicians here in terms of what they've done over the last, over the last almost year at this point. So, but I think we're a different hospital, stronger and a better hospital as a result of it, and looking forward to hearing what Dr. Manning has to say this evening. Thanks, everybody, and happy to answer any questions if there's time.
Thanks, John.
Terrific. Thanks so much, John. I really appreciate it. I know from sitting on the board and being on the board of advisors that was a really brief update with everything that's going on. And I just want to, again, thank everybody involved and thank John's team for doing such a superb job through all these challenging times that have continued on longer than we all hoped, I think. Thank you for that. And if there are questions for John, then just put those in the chat and we'll try and get to them at the end of the presentation. So I had a little write-up that I was going to use to introduce Beth here, but it seems like everybody on the phone seems to know her as well, if not better than I do. But just a little background for those that don't know is Dr. Manning is a primary care physician at Beth Israel Deaconess HealthCare in Needham. She attended medical school at George Washington University School of Medicine and completed her internship, residency, and chief residency at University Hospital in Boston, which is now Boston Medical Center. And during her 20 years at Boston Medical Center, she focused on primary care and medical education. And she came to BID Healthcare in Needham just over 10 years ago, leaving BMC to work here in her current position. And she has served here on the Medical Executive Committee, the Medical Education Committee, as well as on the Provider Advisory Board for APG, which is now called BILH Primary Care. And she just recently joined the BID Needham Board of Advisors. She and her husband, Dave, have been longtime Needham residents. They have 2 children. I was quipping, if you didn't hear to begin with, that we're hopeful that Dr. Manning will prescribe cupcakes to be part of our nutrition plan for 2021. But I am thrilled that we have such great attendance for this conversation about health in 2021. And it is with great pleasure that I introduce Dr. Manning. With her intelligence, frankness, and warm manner, she is a favorite with patients and colleagues alike. And she's also my primary care physician. So with that, I introduce you to Dr. Manning.
Great. Thanks very much, Sam. Let me see if I can just share my screen here. Okay. Can you guys hear me?
We can hear you okay, Beth, but we're not seeing your PowerPoint.
Maybe I should have Alex pull it up then. I mean, I'm sharing my screen, but
Yeah, we're just seeing your Explorer as if we're seeing your computer screen.
oh, okay.
So I don't know
Alex,
if
let's see if I can.
there's pictures of Dave on there. Can we see those?
Let's see. I don't know how. Let's see. Stop share. Let's go back.
Yeah, maybe try it one more time. That's good because I know you had a PowerPoint pulled up.
Here it is.
No matter how many times you practice, it's always the real time when
I know, and you tried to get me to practice more, but I was
there we go.
procrastinating. Can you see that?
Perfect.
Okay, awesome. Is it full screen?
It is.
Okay, great.
It looks
Thanks,
great.
David. Okay. All right. So I'm not sure that I'm an expert on health and happiness, but I'll do my best to give you my observations and also observations from some people that that have inspired me along the way. Thank you very much for that warm introduction, Sam, as well as John Fogerty, and thanks to Kelly Wallace and Alex for helping me practice this, and for Sam Berman and Tracy Murphy for twisting my arm. The first slide, who am I, is basically just to give you a background, but Sam did a pretty good job of that. So first and foremost, I'm the Cupcake Guy's wife. We've been married for, oh my God, Dave, how many years is it? I'm gonna get this wrong. I think it's 32 years, but we've been together for 40 years. We moved to Needham around 1991 or two. We had a pact that we would never live in the same town as a family member, but of course, I negated that and we moved to Needham because my sister Kathy Bromstead lived here, and we've been living here ever since, and very happy to be in this community, which is a very welcoming, awesome community. We already heard about my background. The only thing I want to mention about GW is that 1988 was when I graduated from medical school, and that was at the height of the AIDS epidemic. The only treatment we had back then for patients was AZT, which didn't do a heck of a lot. So we saw a lot of patients at the end of their lives, but very differently than COVID. So you might have 1 or 2 patients on the wards that was at the end of life with COVID. Obviously, you can have 10 patients a day at the end of their lives. And you can't transmit AIDS by airborne droplets, which is also obviously another big distinction. But it was a time when we didn't know what we were treating. And it took a long time to get the medications that we have now that can keep people healthy and living with AIDS for a very long time. The reason I came to primary care in Needham in 2010 was really because of my husband. He ended up having open heart surgery at age 49. And it was basically a time of reflection for me on what was important and where I needed to be. And that was close to home, not commuting into Boston, a less stressful job, and trying to help out more at home. Dave was doing a lot of care at home before he started the cupcake business. He was basically home with the kids for 5 years, and also visiting his father weekly in a nursing home. So we had a lot of time at home, and it's been a good move for me. I was initially concerned going from an underserved population to, frankly, a very privileged population. I was concerned, was I going to be happy? Was I going to be challenged? Would I make a difference? And I think that I'm very happy here. So I'm glad to be a member of the BI Needham staff. I'm inspired by a couple of people that I'll just mention briefly, not in too much detail. Dr. Charles Needham is professor of medicine at Harvard Medical School. And he's done some talks for my primary care course on the value of kindness and how his family basically shaped who he is as a person and as a physician. And I would say the same for me, that my parents, the one thing that they did teach me was how to be kind to other people, regardless of who they were. And that has stuck with me, as well as basically a sense of humility and gratitude, which is something that Dr. Sanjeev Chopra, also professor of medicine at Harvard, talks a lot about. He also talks about happiness being finding your purpose in life, whatever that is, what makes you happy. And that can take a while, but I would encourage you to not only write down your health goals for 2021, and don't make them too, don't don't go too far with that. Just make little changes in your life and things that you think are going to bring you happiness in the next year and hopefully bring you closer to your family and friends. I'm also inspired by my patients. Tracy Murphy comes to mind, and I don't think Tracy is online, but my thoughts and prayers are with her as she is going through treatment for colon cancer. The people that I work with on a day-to-day basis at BID Needham are phenomenal, as well as my colleagues. I'm inspired by my friends, my Stonecrest neighborhood group, some of whom are joining us today. During the summer, it was nice. We would go up to New Hampshire. I was lucky enough to have a place to go to on the weekends, and I have a New Hampshire group of women there that I've basically been walking with most weekends. One is a visiting nurse through Partners. One is a retired nurse practitioner psychologist. The rest have various professions. Some are retired, some are not, some are from other areas of the country. And Dr. Chopra would say that the friends that you have at age 50 is the best predictor of longevity based on studies that have been done. So keep that in mind, and I hope you're reaching out to your friends and colleagues with your needs, because it's important. You don't want to be dealing with this, dealing with life as it is right now by yourself. I'm also inspired by the BID Needham leadership and staff. The pandemic has been horrible, but it's also brought us closer together. I would say that I felt like I was in a silo for many years when I first came to BID Needham. Not anybody's fault, but I was working in primary care and there was very little connection between the hospital and myself. I'm also inspired by frontline workers everywhere. So, and would encourage you to be thankful whenever you can to people that are helping you, whether it's the grocery store clerk or the people picking up our trash, or the people that are valeting at the hospital. Everybody, they're all doing their part, and I think showing them gratitude means a huge amount to them. I'm also inspired by my husband and kids, by my family, and I just wanted to mention briefly my sister Kathy Bromstead. The reason we came to Needham, Kathy taught at St. Joseph's for at least 10 years, if not more, and was a favorite teacher amongst her students. Unfortunately, about 5 years ago, 4.5 years ago, her Parkinson's progressed to the point, well, 5 years ago or a little bit more, Parkinson's progressed to the point where she wasn't able to care for herself anymore, and we had to place her in a nursing home, and she's in a nursing home in JP right now. This is a picture of her from the summer or late fall in the tent that was outside when the weather got colder. She's supposed to have her mask up, but I was 6 feet away, and so I gave her a thing of grapes so that she could eat. And we could talk a little bit. She has more bad days than good these days, but the one person besides her that inspired me there was her friend Josephine, who's 89 years old, always happy and just so joyful and happy with anything that we were able to do to help her. Whenever I would go to see Kathy, we usually put JoJo on at the end so she can have another half hour. She does not have any family members that are visiting. She made the news last week. She was the first patient at Armenian Nursing Home to receive the COVID vaccine. And her comment was, "It's a wonderful day." All the patients there have been vaccinated. I will say that 22 patients lost their lives to COVID there. A number of staff, Kathy's aide got COVID, and she survived but was hospitalized. But both her husband and father died of COVID. So I try to look for joy in everyday experiences. It was a weekly experience with Josephine and my sister. Now, unfortunately, we're not able to visit, but I try to FaceTime with them when I can. I'm also inspired by this sexiest scientist alive who needs no introduction. He was a Holy Cross grad, by the way. Just an amazing guy. He also obviously was in the lead in terms of the AIDS epidemic and research on that front. I was inspired by RBG and will continue to be inspired by her for what she did for women's rights and for rights in general for everybody. I'm inspired by those who stand up for justice now and in the past, whether it comes in the form of Black Lives Matter or caring for, or basically rights for LGBTQ. I'm inspired by those who fight COVID on a day-to-day basis, not only the doctors and nurses, but obviously the day-to-day staff that clean the rooms, and the pharmacy tech who I talked to the other day when I was in the hospital, and those who brought us hope and worked together for the greater good, to produce a vaccine in less than a year, number of vaccines in less than a year. Pharmaceutical companies don't really like to work together that much. They like to make money. But in this case, they did work together. They shared information together, and we have 2 vaccines that are 95% effective. There's also a Johnson & Johnson vaccine through Beth Israel that will hopefully be available, or at least going up for FDA approval relatively soon. And probably more vaccines than that. Who would have thought that we would be able to handle this in that short a period of time, even though it's felt like a lifetime for a lot of us. I want to tell you a brief story before I go on about what happened to me this week that inspired me. So a husband and wife of mine, they're both in their late 60s. The husband actually has more health issues than the wife, but they both ended up getting COVID from basically a celebration on Christmas Day. And Jackie ended up being hospitalized due to the fact that her oxygen levels were falling, and she had basically multi-lobar pneumonia. I got a call from Eric Heckman, who was one of the intensivists that is now at the hospital working with those patients in the ICU, which is critically important. We were using our hospitalists to do that job in the past, and they did a fantastic job, but this requires intensivists doing this job who know how to treat these patients every day. We've learned a lot about treating COVID patients in terms of keeping them prone to keep their oxygen levels up. But Eric called me on Thursday saying, you know, Jackie is on 100% non-rebreather. She had initially said she wanted to be resuscitated if she needed to be, but is now refusing to be intubated. And he said her husband's talked to her, her kids have talked to her. She declines to be intubated. Would you talk to her? So he went in with his PPE on, brought the cell phone in the room. And within a couple of minutes, I was able to convince Jackie to go ahead and be intubated, which is fantastic. I went to the ICU on Saturday. I went to the hospitalist team on Saturday and the ICU on Saturday with gift certificates from the medical executive committee. I think the funnest thing I did this weekend was go to the farmhouse and get gift certificates. My husband got us gift certificates from Treat Cupcake, and I went to Hearth Pizzeria. Delivered them to the hospitals directly and thanked them for what they do every day to take care of my patients and everybody's patients. And then I went inside the ICU. I kind of followed in a pharmacy tech. I probably shouldn't have been allowed in, but was. And I got to thank everybody there, the pharmacy person who was working, the nurses that were working. And Eric was was there, but I wasn't able to see him, but I expressed my extreme gratitude for him for taking care of my patient. She's doing better now. Hopefully will be extubated in the next couple of days, but she could have died within 24 to 48 hours. If she had not been intubated and had he not called me, I'm not sure that she would have been. So I thank them and they inspire me. Our youth inspire me. They teach us tolerance and resilience. You know, it hasn't been easy for kids, and there's a lot of kids that are suffering, not being able to be in their school environment, especially if they have learning issues, but they're amazing. And they teach us, you know, resilience every day. What has COVID taught us? I think it's taught us that adversity is a part of being human. And the difference now is that all of us are facing adversity. You know, at different points in our life, we have to deal with family members or ourselves having cancer, depression, anxiety, loss of jobs. But now all of us are being challenged. And we have to learn from our adversity. I think it's important. I think the key is how we respond to adversity. It's asking for help, admitting weakness, learning empathy, letting go of anger, and trying to take care of each other. Dr. Chopra talks about surrounding yourself with positive people and practicing gratitude. So again, I would ask you to write down a few things that you are grateful for. He recommends doing this every day so that you wake up and instead of being unhappy with your life, you are grateful for the things that you have. He also talks about leading by example. And not tolerating bad behavior, looking around and helping those that are struggling, whether it's one of your patients in my case, or the medical assistant who you can tell is not having a good day, or your colleague that's not having a good day. There is humor in everyday life. I think that's important. Stephen Colbert has been my source of humor through the pandemic. And we need to surround ourselves with people who are tolerant and accepting of those around them. Dr. Needham also talks about the highest form of wisdom being kindness. I won't elaborate more on this, but basically treat others as you would want to be treated yourself. And ask yourself, what I try to ask my patients is, what is most important to you? What are you worried about today, rather than focusing on perhaps the things that are foremost in my mind, like their blood pressure and their weight and their diabetes. We also need to learn the value of humility. I'm not going to belabor this point, but just try to be humble in your day-to-day life, embrace the differences, and put yourselves in others' shoes. So I would like to say that I think the future of 2021 is going to be bright, but we will remember 2020 and we'll try to move forward. I know that we all have created new traditions along the way. We had a remote graduation for my daughter, Emma, in May. Not quite what she wanted, but it worked out okay. We had a backyard wedding in August for Wills and Jamie. We had a backyard birthday party, unfortunately, for my 60th in November. Halloween, Thanksgiving, and Christmas was very different. We've learned to do Zoom and FaceTime. This was our Halloween table. Even though the kids couldn't come to the door, we left our treats outside, and I would try to greet every child from far away as they came, and they appreciated it. They really did. Did anyone get a new pet during COVID? It seems to be a very common scenario, mostly dogs, but other pets. One of my patients actually got a hedgehog, and her daughter has been very happy with that new pet. Pets bring us comfort. They can prolong our life. They can decrease in our anxiety levels. They can decrease our blood pressure. They can decrease our depression. This is my daughter, Emma, with our 3 dogs, Rocky, Max, and Winnie. Remote teaching and learning has been the new way of life now. This is my son, Joe. This is his Halloween costume. This is before, after, as Superman. I've been inspired by him and what he's been able to do with his kids. He teaches 7th and 8th grade algebra in a boys' school in New Jersey called Del Barton. There's been some outside celebrations this year. This was my 60th birthday party, very small group. My friend Lisa came with her husband, and Laurel Martin came with her husband, Zach. We had an outdoor celebration. I specifically wanted to mention Lisa because she is battling ovarian cancer, and she has been an inspiration with me every day. She actually texted me this morning to wish me good luck on this talk in the midst of everything that she's having to deal with. But we still have to deal with COVID. So what does that mean for you? We have to continue to take care of ourselves and our family. I would say we're lucky because we are at BID Needham, which is an amazing hospital with services that have expanded tremendously since I've been here. The breast care center is awesome in terms of care of patients just for general mammograms as well as breast-related issues. We have a new ambulatory care center, OCC, which, if for those of you who have been there, is just a gorgeous building. We have an oncology unit with state-of-the-art services for cancer patients. We have the intensivist program now available at BID Needham. And now mental health, thanks to Valerie Trotman and Sam Trotman-Berman with their donation to the hospital of $4.2 million, focusing on mental health is going to be in the forefront of our mission. We've accomplished a lot since the shutdown. Telemedicine started for me within a week of the shutdown. And we're all kind of we've gotten used to that format. We have immense gratitude for those who are working on the front lines at BID Needham. The community support since we started has been amazing. Now the part about returning to your own health and wellness and acknowledging your limits. If you haven't seen your PCP in the last year and a half and you're over 50, please make an appointment. It may need to be virtual. Please don't put off your cancer screening or vaccination procedures. It's safe to come into the hospital. It's safe to come into the clinic. We're taking all precautions. You should try to exercise. A lot of you are, some of you aren't. And I coach my patients on making small steps to change their habits. Try to eat healthy, try to get enough sleep. Care of mental health and stress reduction is crucially important, and balancing work and home. A lot of patients talk about the fact that there's no break with working from home, and I encourage them to try to take a break, whether it's a lunchtime break or stopping at 5 o'clock rather than going all night, to combat the fatigue that happens because we are working remotely. Telemedicine is here to stay, and has a lot of benefits, especially in terms of anxiety and depression. A lot of mental health providers are now embedded in a lot of our BILH practices. And that's going to improve over time, especially because of what Valerie and Sam are doing. One important point is that whether providers in other states can continue to provide care via telemed is up in the air. So if you go to Florida for 6 months, I'm not allowed to provide telemedicine services right now to you, which is kind of odd, but that's the way it is. We're working on it, but keep that in mind. If your doctor tells you if you're in California or Florida, you may need to get a doctor down there if you're going to be there for 6 months. I would not ask for telemedicine if you were having an acute issue such as chest pain, shortness of breath, acute neurologic symptoms. Some things need to be seen. A lot of things need to be seen. I would rather see you in the office than do telemedicine, but there are some things that it's very good for. Just a couple of points. If you have hypertension, you should get a home blood pressure cuff. If you're over 65 or have chronic health issues, get a pulse ox and a thermometer at home so that if you do get COVID, you can check your oxygens at home. Routine healthcare maintenance, I won't belabor, but there are issues that you need to take care of, such as pap smears, mammograms, colonoscopies, vaccinations if you haven't gotten your shingles shot or your pneumonia shot in particular. And if you have chronic health issues, don't avoid seeing your specialists. They are doing telemedicine and seeing patients in person. So I ask you to keep moving forward and take care of each other and to ask for help if needed. How do you protect yourself and your family? Continue to do the same things that you've been doing. We have a long ways to go, but we're getting there. Vaccinations will be available to you. And if you have particular issues or questions, go to the mass.gov website. There's a lot of useful information there, and continue to do the right thing, wearing a mask, social distancing, hand washing, etc. I'm not going to be able to get to the clinical cases. I would just tell you there's been a lot of issues with alcohol misuse, substance abuse, depression, anxiety, uncontrolled hypertension, weight gain. And I work on it with patients one at a time because everybody's challenges are different. I'm going to skip the common clinical issues. I will comment on the elderly, particularly vulnerable now. It's very important that they have hearing. And I talked to Janice about her mom today, who's now wearing her hearing aids. Sometimes if you tell patients that there might be progression of their cognitive impairment or that might lead to cognitive impairment if they don't have their hearing aids, I don't want to scare people, but it gets to them. And sometimes they'll start wearing them. Make sure that they're up to date with their vision appointment, especially if they have glaucoma and macular degeneration. Focus on their mental health, assess for substance misuse, fall risk, cognitive impairment. I won't talk about impaired driving because I do have some patients that are in their late 80s still driving around. I try to assess them as much as possible that that's a safe endeavor. Home safety and polypharmacy is a huge issue that I deal with on a day-to-day basis with my patients. So we need to get through the next few weeks and months. It's critical. This is the when to test for COVID, either asymptomatic or symptomatic. I look at this every day until I get dizzy. The vaccine is here, but we need to be patient. It will be coming to you. Try not to put yourselves or others at risk in the meantime. The best day of the year for me and my husband, I'm sorry if you don't like Joe Biden, but it was November 7th, 2020 when he was declared the president-elect. And this is just a shout out to the best husband, friend, and soulmate that anybody could have. I'm going to stop there and we'll open it up for questions.
Thank you so much, Beth. I know that's hard to do as well when you know you have a lot of people listening and you can't hear anything because we're all muting to be respectful.
Yes.
So what I really appreciated about that was the personal flavor that you brought to it, which I really appreciated. And you know, I think one of the great equalizers, if you like, of COVID is that there's nobody pretty much on the planet that has not been affected in some way. And so I think it has been an opportunity to understand our humanity and our vulnerabilities and to be able to have conversations about that I think were not possible before. So I very much appreciated that. So I've been looking at the chat, and I don't know if we just haven't encouraged people to use it, but I don't see anything there. But
actually, Nancy Yablonsky, one of my patients, asked about polymedicine. It's actually polypharmacy. So polypharmacy in the elderly is basically anything over 5 medications. I know most of you with your elderly parents know that there's a lot more medications than 5 usually being prescribed. So it's important if your elderly parent has multiple medical providers that they're communicating with each other, and if you have any concerns about medications that they're on that may be causing problems, that you talk to the primary care provider. I see myself as kind of the overseer of care for my patients. They might have a cardiologist, they might have an endocrine doctor, a psychiatrist. I'm the one who kind of looks back at the big picture and tries to make sure that there's not things being duplicated, that the patient isn't getting the wrong medications or duplicate medications from various providers. So polypharmacy is basically assessing for that issue when you see your elderly patients. Eric, one of my primary care patients, wants to know when he can get the vaccine. That's the question on everybody's mind. I'm lucky that I belong to BILH Primary Care so that we have a larger network that we draw from to be able to get the vaccines. And what we've been told is that we'll be starting to vaccinate patients in February. The first patients on the list are going to be those over the age of 75 or those with under 65 with 2 or more chronic health issues, is what I've been told. So there's going to be a lot more information on that forthcoming. And as soon as we get that information, we will relay it to you. You can always go to mass.gov to get general information. We're generally following the CDC recommendations as well as mass.gov for who's going to be vaccinated first. Right now, we're still vaccinating our healthcare workers and frontline workers. But those of you, you'll all get it. I hope you all, I encourage you all to take it. I got both of my vaccines, minimal side effects. My husband wanted to know why I didn't steal him one for the way home. And he asked me now, can you grab me a vaccine on your way home? Sorry, Dave, you got to stay in line with everybody else. So yeah, it's coming. I encourage you to take it. The only people that can't take it at this point are people with severe vaccine reactions, anaphylactic reactions to vaccines, or people that are allergic to polyethylene glycol, which apparently is, there's something in the vaccine that's a close cousin of that, so you can have an allergic reaction. Nancy's asking me how my shoulder is, so I had to be on the other side of the coin when I dislocated my shoulder right before my 60th birthday, and basically was in the waiting room with a lot of 80-year-old women who had also dislocated their shoulders. And it's good, Nancy. I was seen by Katie Granick quickly, and I'm on the mend, so thank you for that.
Beth, I think there was also a question in there about where we might expect to go to vaccines. So from what you know, it will be coming to the practices as well as the hospitals. Do you have you heard anything about being able to go to like the local pharmacy or Walgreens or what have you?
Yeah, I do know that Walgreens and CVS will have it. I also have heard Pam Worthington, thank you, Pam, for joining, is my right-hand person for the primary care course that I run. And she also has a second job working for the Department of Public Health, educating people about the vaccines. And she was telling me that there's some plans to use large facilities like Fenway Park, what used to be called the Garden, which is called something else now, to vaccinate people as well. Walgreens is the group that actually went out to my sister's nursing home to vaccinate. So I think you're going to see various locations that you're going to be able to be vaccinated. I hope we can do as many as we can in the clinic, but if it's offered to you through Walgreens, CVS, the senior center, some people work obviously through a hospital and they're able to get it that way. We'll have more information, I would say, in the next couple of weeks as to how that's going to be rolled out to the general community. Try not to call the office to ask those questions. You can certainly send a message through the portal, but we're getting inundated with questions for which we don't have the answers except to say that it's coming, and we'll make sure that we let you know. We won't leave you behind.
Great. And is there talk yet about how long the vaccination covers you for?
Unfortunately, we don't know the answer to that. It may end up being like the regular flu, We may end up having to get a booster every year. I hope not, but that's possible. And once you have the technology there, in these two vaccines, it's an RNA vaccine. It's pretty easy to make small changes and get the vaccine up and going if you have the production capacity for the following year, like we do for the flu shot every year. Pam actually put something in the chat about mass.gov. Where can I get the COVID vaccine? Thank you so much, Pam. Pam inspires me every day as well because she's working 2 jobs as a single mom and taking care of her 2 kids. A lot of people have had to do that while still providing amazing support for me in the course that we run together. Any questions about COVID in particular? Anybody put their health goals in that they want to share with the group, or what they're grateful for? I'm grateful that my husband is cooking dinner for me tonight, as most nights. He's an amazing wife.
In my case, I would be grateful that I'm not eating something that I cooked, because that's not on my list of qualifications. So
I just heard Go ahead, sorry.
If anybody would like to share either with everyone or just with Beth, any goals, any other questions and so forth, I would love to get your perspective, if we have a minute, Beth, just on this, the embedding of healthcare professionals in the practices, because that is something that was kind of a mandate as Beth Israel and Leahy came together. And so I'd love to get your perspective. We do have a question that came up about Tylenol with the vaccine. I don't know if you saw.
So let me start with your comment about mental health being embedded in the clinic. We were lucky that Beth Israel Family Medicine and our practice internal medicine, we have a provider, Greg Spire, who's been embedded in the clinic. He started right around COVID. So I don't think he saw too many people in person, but he's been doing telemedicine visits. It's been extremely helpful for a number of reasons. It's very hard for people to find a good therapist. Even if he's not he's basically there to kind of stabilize people and point them in the right direction if they need ongoing therapy. I think he's been most helpful for a couple of my patients who were younger and were dealing with substance abuse issues. And he got them hooked in with providers through the addiction center at BID HealthCare. A lot of patients don't want to go to a therapist. I think it's easier now that it's online, especially for younger patients who I think like the telemedicine aspect of things and are willing to set themselves up with a therapist that way. But he's been fantastic. I refer a number of patients to him. He also has a psychiatrist that he works with. So if I have a patient that I can do basic anxiety, depression, ADD stuff, but if it gets more complicated, I need the help of a psychiatrist. And he is basically will ask the psychiatrist and get back to me on those issues. So it's been fantastic. And I hope that continues to expand along the BILH community.
Absolutely. Absolutely. Thank you. There was a question from Shauna about testing and also trying to cut down on the wine, which I think I will speak for myself. I know a little bit of a drink at the end of a stressful day has become more of a habit, especially when I don't have to drive my kids anywhere. So maybe that's a 2-part question there about testing. And then also how do we self-medicate in a healthy fashion?
Yeah, so in terms of the vaccine and Tylenol, I don't think there's any issue with using that, or if you need to use ibuprofen, naproxen, I would do it after the vaccine, obviously, if you get a fever or your arm is sore, there should be no issues with that. Also, no issues with using either one of those when you have COVID. There was some question initially, should we not be using anti-inflammatories, but it's perfectly fine to use those. It's perfectly fine if you're an asthmatic and you need prednisone for an asthma exacerbation to do that. It doesn't make you more susceptible or more at risk for getting bad infection. It's better to treat your asthma than not treat your asthma. In terms of where to get tested for COVID, that's been tough certainly since Thanksgiving. Huge uptick in people that want to be tested. If you're asymptomatic, you have to go to one of the sites that provide that care, which can be, you can look through Stop the Spread, which is all across Massachusetts. Urgent care centers such as CVS Carewell, other urgent care centers are doing this. But again, they will test you if you're asymptomatic. Urgent care, Chestnut Hill, urgent care Dedham, which are BI facilities, they do not test asymptomatic patients. There is a lady who in Needham who apparently comes to your house and does it for $100. I'm afraid to give out her name as she might kill me. There is at the Riverside train station, there's a COVID testing site there, which has been very busy. But if you Google Riverside COVID testing, you do have to pay for that. I think it's about $90. I'm not totally sure, but a lot of these other places are free. There is home testing that you can do. I have different feelings about that. I mean, if you're positive, you better tell your primary care doctor, don't let it go. Don't hide it. But you can avail yourself of that, although you have to pay for that. And if you're having trouble, just reach out to your primary care, at least for advice on where to go. And again, the government website through Massachusetts has been very helpful. Pam, if you want to add any more information about what you've learned on that, you can let us know.
There's also a relatively new setup at Terminal E at the airport. And the way that the parking works there, and maybe it's not well known yet, but they offer the rapid test as well as the PCR test that takes 24 hours. Right. And so yeah, so that's been a good source too.
I would say that the rapid testing, we're going to start doing rapid testing this week. That's only for people that are symptomatic. It's really not a good test if you're asymptomatic. It's only about 70%. In the general population, about 70% sensitive. In a person with symptoms, that goes way up. So the plan for us would be if a person needs to be tested, but they're not sick enough to go to the hospital, that we will have them tested at BID Needham. That will be available. We'll also start seeing patients with what we call influenza-like illness symptoms. So again, not sick enough to come in the hospital. We're not sure if it's heart failure or COVID or COPD. So we will evaluate them and they can get COVID testing when they're being evaluated. That's basically new for our clinic as of this week.
There was a question also about the different testing sites. I do know that there seems to be different methodologies for the PCR. You've got the saliva test, the short swab, the long swab. Are there any differences in accuracy? So the PCR test, the test that would take about a day, if you're lucky, a day, if you're not lucky, 7 days to come back, is the more accurate test. I don't think it necessarily, the saliva test is also fairly accurate, but most people would prefer to do a nasal swab to really get to the back of the nose to get a positive test if the person is positive. I know some schools are doing saliva testing for their students, which I think if you're just testing that group might probably make sense. I think that is a PCR test as well. So if you're symptomatic, you can get either the PCR test or the point of care test. If you're asymptomatic, you want to get the PCR test. And I don't think it matters where you get it. I think they're using the commercially available tests that have been researched for this purpose. And maybe final question back to that. Any advice on that extra glass of wine, extra drink that sort of creeps up on you and then becomes a habit?
Michelle Hoffmeister is sending something about mass.gov. Okay, great. Oh boy, I know my friends are laughing in the background because they know I've never turned down a nice glass of Chardonnay. I would say if you want to reach for that glass of wine or that beer or whatever you're using to, gummies seem to be very popular these days. As long as they're CBD, I think that's fine. If you're getting into THC gummies, you should be careful because they're very powerful. I would say try to go home and do something else, whatever it is that relaxes you. For me, that's exercise. For other people, it's listening to music, listening to a podcast, talking to friends. Give yourself a half an hour before you go to that refrigerator and pick up the glass of wine. But it's hard. And I understand everybody's going through a hard time. I had a patient the other day, I'm like, he's drinking, they joined like a cocktail of the month club. And I'm like, do that third drink, do you really need it? And he's like, it's so good. And I'm like, well, that might have been fine for the first few months when we thought we were all going to perish in the COVID era, but now it's, we're almost a year out. It's time to back off that. If you do think you're having a substance abuse issue, either with alcohol or drugs or whatever, Frada says having a glass of water after the glass of wine is helpful. Thank you, Frada. You should talk to your doctor. There are medications out there for alcohol use disorder, and there are treatments, obviously, for opioid use disorder out there that are available, and for marijuana use disorder.
Well, thank you. I think we are coming to that time of the hour. It flew by, which means it was an excellent discussion. So thank you once again, Beth. That was terrific. I just wanted to remind everybody that, as Beth instructed us, if you don't have a primary care physician, you should find one, and you can do that through the BID Needham website. If you have any problems with that, you can contact Kelly Wallace at the Office of External Relations and ask her. And then I would love for everybody on this call to join us for our next webinar, which is navigating screen time, digital socializing, and parenting during COVID-19. So definitely one that I will have a strong interest in. And that's going to be on Thursday, February 11th from 7 to 8:30 p.m. And we'll send around, obviously, reminders of that and hope for some RSVPs. So
I was supposed to put Kelly's mentioning about primary care physicians on there, but Kelly Wallace put that in there. So there's lots of good providers out there. A lot of our panels are closed, but in Needham as well as in Wellesley, there are definitely providers that are looking for new patients.
Terrific. Well, thank you so much. Have a great evening, everybody. And thanks so much again, Beth. Appreciate it.
Thank you very much. Have a good night.
Thank
Bye-bye.
you.
Woo!
Thank you.
Ah, Joe! Thanks for
Beth,
coming,
you're the
Joe.
best.
Who's that, Debbie?
Beautiful job. Great job, Dr. Manning. Loved it.
Oh, thank you. Good to see you both. I'm glad you were able to come.
You as well.
Very
You're
good.
very compassionate. We like that.
Thank you. Thank you. I'm
Yeah,
glad
we're
you
going
joined
to
our
have to
show.
have you come back for a return visit, definitely. I can tell already.
Yeah.
Definitely.
Okay.
All
No
right.
problem.
Always said you're a good communicator.
Thank you, doctor.
Thank you very
Dr.
much.
Manning.
Thank you.
Appreciate it.
Thank you, Dr. Manning.
Thank
Love you, Beth.
Good to see you all. Bye, guys. Good to see
Be
you.
blessed.